if whether you're jumping in from your morning, your lunch hour, all of that, thanks for joining today. If you haven't attended one of these sessions before, um, my name is Jenna. I am on the TDS Health customer engagement team. So we do variety of different sessions to talk about products that you may already have and how to utilize them, or things to introduce that maybe you want to look at as possible expansions or new purchases. So I'm going to be leading the demonstration portion today. We're going to look at some of our anatomy tools that we have. We're going to look at two products. And I'm joined by my colleague Shelby, who is a member of our sales team that some of you may know if you work within her territory. And she's going to support me with this presentation as well. So, Shelby, you want to quickly introduce yourself?
Yeah, you did a great job. I'm Shelby Newman, and I cover the states of Florida, Georgia, South Carolina, Alabama, Arkansas, Mississippi, Louisiana, and Puerto Rico. So if any of you are located in those states, either nice to meet you, nice to see you on here. We've talked before. So thanks for joining.
Awesome. So I see that people are getting pretty comfortable with our chat feature. We also, I believe, have a Q&A feature as well. So feel free to pop questions in as we go. I'm going to have Shelby monitor that for me, and she'll call those out to me as we go. So if you think of anything or if you need anything addressed as we move through, feel free to pop it in there. Um, this session's going to be pretty general. We're going to look at a couple, like I said, two different products we have, and then looking specifically today at the more focused within the anatomy and physiology space within those. So I'll call out on a couple of them that there are other disciplines and specialties that are within them. Because we're focusing predominantly on anatomy and physiology, but I'll call out a couple other places. That way, if you've landed on this webinar and you have clinical specialties you support, or you've got different levels of education, being anywhere from undergraduate, prerequisite, graduate level, there's different materials throughout. So I'll make some little kind of call outs as we move through. Um, Kind of areas that maybe we're not showing today that may be of interest, and then we can obviously set up another time, whether that's with your rep or if you're a current customer with me, to train on those things and look at them a little bit more. So I've got my handy dandy little agenda here today that I'm going to quickly kind of break down for you all. It's only a 2-slide PowerPoint. We're going to spend a lot more time in the products. So um, you'll see that we've got the welcome and session overview, which we just did. The two products we're going to take a look at are going to be Anatomy TV powered by Primal Pictures, and then as well as Ditki. So those are the two resources we're going to focus on today. We're going to pop into both of them and do some degree of a live demonstration of the product and talk about the pieces within it. And then also talk about how some programs are utilizing these. Shelby will be able to provide some feedback as we move through just on client experiences, things like that. And then, like I said, I'll be able to answer questions as we move through. And we'll move through these and kind of take a look at the material overall. Um, we do see these bundled together quite a bit. We do see them purchased separately. So just something I want to call out that we have some people use these as complements. So we'll talk about how that can be done as well as we move through. We're going to start with Primal Pictures, so looking at Anatomy TV. I popped my screen over to my Anatomy TV dashboard. If you have access to Anatomy TV, this may look somewhat familiar to you. It may look a little different if you have access to different modules than I do. I have access to all of them. But the dashboard itself, if you have access to Anatomy TV, will look something like this. Quick elevator pitch about Anatomy TV and Primal Pictures. So they're based out of the United Kingdom, and I could tell you all the different things that they pride themselves on specifically for their product, but the one that they really lean into is their medical accuracy. So the material we're going to be looking at today is built off of real scan human data versus being artistically rendered, therefore giving you a really accurate look at the anatomical views we're going to take a look at. Um, The product itself is very much leaning into the anatomy space, like the name implies, but there's going to be a variety of other facets in here that can be useful outside of just what you would think of as an anatomy and physiology course. So today we're going to be looking at the anatomy and physiology module, which I have here on my screen. But quickly before we go in there, I do want to call out, like I said at the top of the hour, they have a variety of different clinical specialty materials. So whether you're within speech language pathology, if you've got some dental hygiene programs, um, we've got additional material in here that is geared toward even those more particular clinical specialties. And then if you've got some advanced level courses who are looking to do more of some like true virtual dissections and custom model creation, things like that, we've got some resources, one of them being the 3D real-time product, which is where you can like completely create your own custom model and do all of those good things. We actually just added on an embryology piece to that as well, which takes a look at those embryological stages in that way. So just want to call it, there's a couple of different areas outside of the anatomy and physiology we're looking at today that you may have access to or interested in. But today we're going to lean into this. So if you are a librarian or if you teach anatomy and physiology, especially that 201, 202 A and P course level, these categories may look pretty familiar to you because they're very much in alignment with usually like the chapter organization within an A and P course. And so this is intentional. So these individual pieces of the module can align with those standard teaching methods within anatomy and physiology. Um, One thing I like to do within here is instead of going into the muscular system or the skeletal system, which are great and we have content in here, I like to pick some of these other areas because I think the imagery in here is what really differentiates this from other anatomy and physiology tools. Looking at things like histology, the nervous system, the cardiovascular system, and getting to see some of those microanatomy views. So I went ahead, I have the nervous system open up here. So this is going to be how the product is laid out. Think of it like a navigation dashboard on your left viewing panel here in the center. And on the right-hand side is going to be almost like the textbook portion of this. So you've got these learning objectives, and then you have actual textbook text that you can move through and review while utilizing the corresponding model in the center. And then each of these topic areas on the left is going to serve almost like chapters. So these are section chapters within that topic that you can move through. Like I said at the top, I like to show some of these microanatomy views. So this is like the action potentials. I like to show things like the synapses where you have these interactive models that you can get some of these views that are sometimes really hard to conceptualize within an actual textbook, being able to see it in more of like a 3D space. And again, as we move through the topic areas over on the right, through that kind of chapter piece, you'll see that you've got these different views throughout. So in having the interactive textbook piece where you have the actual verbiage, you have this interactive model here in the center to move through the different images that you're seeing and the different structures being notated. This does have an interactive component in addition to having kind of that textbook excerpt piece and the interactive model here in the center. Over here on the left-hand side in our navigation, we've got an index where you can search through materials. We have an interactive learning section. These are going to be things like matching activities, um, doing like some fill in the blanks, so different pieces like that where you're able to go through and do some interactive elements in here. These are more of like a self-guided style, so kind of like that end of chapter exercise thing that you've seen in a textbook before. That's what these are intended to be, is something that students can use as almost like a end of chapter checker or something to learn throughout. We do also have programs who have people go in and do these assessments, these interactive learning pieces, and then also the quizzes, which I'll show you as almost like a way to remind the student of this topic. If it's something that maybe they took in a prerequisite course and they're about to deep dive it more, they'll have them use some of those components as well to kind of refresh their information and refresh their brain before they go into the next stage of whatever topic it is that they're looking at. So this here is the quizzes area. So like I said, you've got the interactive learning, which is going to be anything from, like I said, labeling, point and click, all of those kinds of good things. And then you also have these integrated quizzes in here where you can go through and answer, you'll get your score, things like that. We don't have this right now to be able to kick back to your LMS in this format, but you do get a scorecard at the end. And I do have some people who will take a screenshot of that and submit that as a way to show they've completed it. So just something to call out there. Next section is going to be some clinical correlates. So this is where we take these concepts within anatomy and physiology and apply them in a clinical space. So you'll see that we've got the clinical section, which is going to have different conditions that this relates to within that topic area. You also have aging. So it'll show how this particular system is affected by aging over time and how that applies. And then also we've got some case studies in here looking at particular circumstances where you can go through and assess yourself some questions, reveal yourself answers, and move through these. I see these really utilized as kind of a way to take the information that you've learned within the chapter and then apply it in that clinical piece. I see this a lot at the nursing level, as well as even in undergraduate medicine as a way to remind yourself of how these pieces apply to the conditions that you'll be deep diving more on as you apply those foundational concepts. So those are additional pieces that are in here. That is the bulk of the content piece of that. So the last couple stages in here are going to be more of like the sharing and interactive pieces of how to utilize the material. Were there any questions, or Shelby, did you have anything you wanted to add at this point?
Yeah, I mean, just to reiterate that this module does have all of the content that any major A&P textbook has. It adheres to HAPS guidelines. This module in particular also does have translation into Spanish. Um, and you mentioned the dynamic range of courses that this can be used for. So anything from pre-health, fundamental courses to a refresher in nursing. I see that a lot, where I've spoken with nurses and they say that their students are having to get a refresher on A&P. And I have seen A&P utilized anywhere from massage therapy to physiotherapy, OT, PT, SLP, athletic training. So quite a myriad of courses.
Awesome. I did see a comment in there about not seeing case studies within, so we'll take a look at that because that might be something goofy. So we'll look at that into you. We'll look at that for you, Tina. Um, the last couple pieces in here are going to be the sharing functionalities and the user functions. So we went through all this different content, we talked about all this different stuff, and now it's how do we utilize this? And so there's a couple of different ways that you can use the anatomy and physiology content within anatomy TV, and those are going to be over here on the left, right after we complete the clinical correlate section we're in. So the little star that we have here, this is where you can create favorites. So you can build favorite folders. You can organize those folders to have different images or sections saved for reference. I see people utilize this to build out their own courses. I see faculty instruct their students to build favorites. That way they have material they can quickly jump back to. You also have the ability to create what's called a personal profile. And so when you click your little star here, it's going to prompt you to sign into a personal profile or complete one. This is completely optional, but I do say that for those who have access to like maybe a really large subscription of anatomy TV content, you've got a variety of different modules, and maybe for certain courses, those students are really leaning into one or two, and you want to kind of organize that in a way where their dashboard, when they look at all the modules, isn't so cluttered and they can kind of lean into their particular specialty. That's where a personal profile can be really useful because you can kind of pick and choose what you see when you log in. It also allows you to have some freedom to jump to device. So everyone's access is different when it comes to anatomy TV, depending on how your institution is set it up. But one piece that I like to point out is that a lot of times Anatomy TV is device specific. So if you log in on your laptop, however your institution has it, you save a bunch of things, you make a lot of favorites, and then you go and you're on the library desktop, or if you're in a lab desktop, or you jump on your phone, you're not going to have those saved pieces there because that's specific to the device. So by creating a personal profile, you can log into that anywhere and get access to those favorites that you've built out. So if you have access to a smaller set of modules, you don't intend on hopping on a bunch of different devices, you may not feel the need to build a personal profile, and that's okay. But if you do have an intention to jump around between devices, or if you want to kind of have your students organize the material to be more specific, that's a really great way to do that. So this is that favorite section. Again, you can build folders, you can create different organization tactics in there. I have some faculty who literally build out their semester in favorites. And then every semester they maybe make adjustments to those or switch them out and around. And then students, they can do that as well. So they can save material for things that they might be referring to quite a bit in lab, and then you can have them build out favorites. So that way they can get to them quickly. The next one is going to be the copy link tool. This is one of the most common sharing tools that I see utilized because it is very easy to utilize and kind of accessible for everyone. This copy link tool allows you to direct someone completely to the view that you're looking at. So let's say that I want all my students to get to this view of the brain with this structure highlighted at this section, and I want them all to be right here, and this is where I want them to go. I can use this copy link to build a link, and then if they put that in a PowerPoint, an email, a chat, and click it, it'll log them in and take them directly to this view. So if I want them all the way in here at this particular view, your copy link tool is going to be the way to do that. Um, Similarly, but a little bit different, is going to be the embeddable viewer tool. And this is one of the more newer sharing tools that the Primal team is added on. And this allows you to embed the content directly into your LMS system. So let's say, contrary to the copy link, where you want your students to go all the way into the resource to look at what you want them to see and then bounce around to different stuff. Let's say that you want them to stay on one particular view, one particular section. That's where you want them to go. And let's say that you live outside of Canvas. Everything is in Canvas. You put everything on your course pages there. This allows you to embed this directly in there. So this interactive view that we have here in the center, the ability to add and take away layers, all of those things, we can embed that directly into Canvas. That way you can access it there directly versus going entirely into the product. So I recommend this a lot if you've got a couple views in here that you tend to use for quite a few weeks within a course. You can embed it directly into your Canvas system. And the last option is a save feature. So this allows you to save still images, save text, and save it as a PDF. So let's say you don't need those interactive pieces, you just want to pull the material out to use later. You can use it in a still image and use the save feature. It's under your subscription, covers the copyright coverage, so you can take material out. And that's kind of the main rundown. I stayed in the nervous system. I think I just saw someone wanting to pop into histology really quickly. Is that right, Shelby?
Yeah, histology.
Perfect. So you'll notice once I pop over to histology that the layout is going to be the exact same. The only difference is going to be the content. So you'll see we still have that navigation panel over on the left, our viewing panel in the center, and these learning objectives over on the right. And so again, you'll see that each topic area is built out. So it's almost like those chapter pieces of certain subjects. I like to specifically show a couple of pieces within histology. I like to show the epithelium. So you can see some of these views, hover over select structures, and then over on the right-hand side, you can move through different cells, different versions, and look at them specifically. So this has that same interactive piece that you have that we looked at in the nervous system. All of the different sections within the A&P course are going to have a similar structure like this, except for, like I said, it's just going to differ in the type of content. So within histology, we're going to look at different areas. So, like, here's histology of bone and different views like that.
Jenna, you showed the relevant structures tab, right? Or no?
Oh, the visible structures tab?
Yes.
Oh, good call out. I have not showed that. So, um, down at the bottom right, you'll notice that there's this section called visible structures, and this actually lists out all the structures within this view that you can actually move through and look at to ensure that you're catching each of the different structures that's being developed and shown in the model. Um, Shelby, I don't know if you've seen this, but I've seen it where people they assign the students to look at the visible structures list and have them make sure they pick up each piece.
Yes, I definitely see that a lot for those that utilize the flipped classroom approach, where they want their students to come prepared with some knowledge before a topic is discussed.
Perfect. I did see a note in the chat about having the Canadian rep reach out, and we'll do all of that. We'll look through those details to make sure. So don't worry, we'll make sure we get someone to you. Um, so that's going to be the main rundown of the anatomy TV portion. I am going to move over to Ditki, but before I do, I want to just verify if there's any lingering questions real quickly before I hop out of anatomy TV.
And I just want to reiterate that this module does have the accessibility compliance. I noticed that that's a big request that I get from state and community colleges. So if that's a question, it is.
Thanks, Shelby. Another piece, and Shelby, you've worked with this quite a bit, is we talked about at the top just very quickly before I hop out of here. Anatomy TV is very frequently bundled with variety of different modules. So we looked at anatomy and physiology specifically, but if some of those clinical specialties we looked at are of interest to you, or if you want something that's got some more kind of virtual dissection element, there is a lot more in here as well. Um, the last piece I want to point out is that you do get an anatomy quiz with your subscription to anatomy and physiology. And this very quickly, um, every time we do these sessions, I go right up to the half hour. So be prepared to be sick of me by the end of this. You have the ability to build out a quiz in here. So this is really good for self-study for students. So you have the ability when you're building your quiz to pick section, and then you can decide the different system, the region, and then also if you what type of question, whether it's what is, where is, or a mix of this. And then you can use this as a way to create a quiz for you. So what you'll do is it'll generate a quiz and you can move through, submit, and have it show you when you get it right or wrong as you move through these.
Jenna, there is a question, is
Sure.
there clinical content within histology?
Well, is there clinical content within histology?
Yes.
So, what I would say within histology specifically, the clinical content is going to be, let me close out of some other stuff. It's going to be within the clinical correlates section. And here you'll have, this is where those case studies and those pieces live. This is where I would say the bulk of clinical content would be in here. So you'll have kind of these case study or clinical elements of certain conditions. So you have those here. You have the aging section as well. And then you've got a case study area, which has got different case study presentations of certain conditions that relate within histology. So these are what I would say would be specifically the clinical content. And then I can deep dive that a little bit more if you want me to look into it to see if there's any other pieces that I might be missing that we're not covering in our short run through. So that off the top of my head is where the predominant clinical element is going to be within histology. If there are any other pieces, I'll make sure to follow up with some additional details. So for my last kind of 5-ish minutes that we have here, I may go over a minute or two. So if you have to run away and hop off right at the half hour, we will get um, a recording out to you for those who have to get out of here. You should have access to the case study pieces and the clinical content within your subscription, unless we're operating on a way older version that we can double check for you. So those things should be in there. If you have A&P, you should be able to see those. Hopping over to Ditki. So my little elevator pitch for Ditki is it was previously known as Draw It to Know It, founded by a physician by the name of Dr. Adam Fish, who's a neurologist. And essentially, the core of the Dickey design is that he wanted to implement a resource that had material for every type of learner. So, whether you're someone who learns from listening, so you're an audio learner, a visual learner, a kinetic learner, someone who likes to draw and have that pen to paper piece, this resource was designed to encompass all of those things. So, you'll notice on my page, I have all courses within Dickey. So today we're going to stay within the anatomy and physiology space, but I do like to call out that you'll see on my screen there's a variety of different course offerings that you can that you may have access to or that you can add on if that's of interest to you. Anywhere from graduate level to integrated systems, we even have material for certifications like USMLE, things like that. So all of these different pieces go into building out the Dickey platform. But with today, we're going to focus on anatomy and physiology. And the three I'm going to point out are going to be this first one here on the far left. That's anatomy and physiology fundamentals. And then over on the far right, advanced anatomy and physiology fundamentals for nursing. So if you have access to any of these, this will be a great review for you. If you don't and you want to learn about the Dickey pieces, this will be a good introduction to kind of how this all works within here. So the anatomy and physiology fundamentals within this kind of high school category, I would say that this is still very much applicable to like a 201 course, where the advanced anatomy and physiology adds on a little bit more, so slightly above. And then the nursing element is where we add a lot more of kind of those clinical implications to it. So that's how those three courses differ. But when we look in here, you're going to notice that the layout is the same, similar to how within Anatomy TV we have the same structure layout. Dickey is the same as well, where we're going to have the same layout for all the courses. The content's just going to differ. And so in here, you'll see here at the top is where we have all the different types of material you'll have, whether that's tutorial videos, flashcards, subject exams. There's all different types of material in here for your review. Um, we looked at specifically the nervous system when we were in anatomy and physiology in Primal Pictures. So I figured that might be a good spot to hop over here to kind of just show you how people utilize these as complements to each other. So if you're doing the interactive textbook pieces within Anatomy TV, you're looking at the individual interactive models. This is another place to reaffirm some of those pieces that you might have been looking at within there. And so we have different tutorial videos that we can take a look at. I'll pull one up for you so you can see what it looks like. I'll play it and I'll go ahead and mute it so we don't have anything overlapping. But I want to predominantly show is that you'll notice that with these tutorial videos, we're building out on the screen. So nothing is popping on and off. We're just building. And this is very much intentional. This is something Dr. Fish talks a lot about is the idea of memory scaffolding and actually generating memory for long-term memory versus short-term. And what he was seeing is that with a lot of content out there that students are watching, it's either too short, where they're rewatching it 100 times to try to get little pieces from that 30-second video. It's too long, where they almost are like, I might as well just sit in on a lecture, which is already hard enough to get students to do. And then also where you would have these videos where things were popping on and off the screen. So by the time you finally start to understand the imagery you're seeing, it's gone. And so all of those pieces were how he built out his tutorials to where they really are building upon themselves. So you start with a small piece like this table that we saw, and you build out the material as you move through. So by the end, you've taken this more complex thing and you've built it out into small pieces to where it's more digestible. And so that is the way that the tutorials are built out, whether it's a table or a structure image or labeling, you'll see it all built out that way. And then you have some corresponding interactive pieces that you can do with it. So tutorial plays through, you've got notes over here on the right. These are going to be different notes that relate to the tutorial specifically. And then you can go into your drawing pad. And from here, we have a couple of options where we can draw along with the video. We can do a starter image, We can label a diagram. You'll see my little drawing and pieces in here that I was doing, but you'll see that we have the ability to either label a structure, or we can go in and we can do a starter canvas, or we have to build it ourselves and fill these things in. And so this allows you to take that tutorial, that building out we just saw, and have a kinetic drawing component that you do yourself. In addition to that piece, we also have some quizzing. So there's quiz questions that go along with these tutorials that you can answer, review, and look at explanations. And if we hop back to our course, I also want to point out the flashcards because these are really, really popular. People really like these. Where you have these flashcards that you can move through and look at the different term images to understand different topics. So that's the bulk of the content area. I know I'm running up, but I'm over time, so I wanted to make sure I kind of popped into everything. I want to quickly call out the administrative features within Ditki for those who are still able to be on. If you had to hop off, we will get the recording, do not worry. But you do have some administrative functionality in here where you're able to create custom courses and also build out study plans. And Shelby, this is probably something that you've seen working with clients specifically, is that that customization allows them to be more specific to what they want to deliver to their group.
Absolutely. Yeah. So this Draw It to Know It Ditki can be completely customized to suit your syllabus needs, whether it's even the just simple rearrangement of modules in order of how you study or adding content. They are more than happy to help you customize completely to suit your course needs.
Yeah, and just to give you an example, these are two different courses that that we have current clients that have built out where they had access to a variety of different courses in Dickey and they wanted to organize them for particular courses they were delivering. And so this is an upper extremity course. This is for an occupational therapy program, but just to kind of show you, we took their syllabus and then we added modules in from their Dickey subscription to align exactly with their delivery. And that's something included with subscription. So if you have access and that's something you want to do, we can connect with you and work you with the Dickey team to build that material out for you. I am over time, so which unfortunately tends to be a little bit of a reoccurring theme for me. Were there any questions about generally about the content that we looked at or anything that people need right out the gate? Okay. I know we had a couple questions about getting people in touch with reps and some content questions, so we'll look into those and get some information out. I'll also want to invite that anyone who is on here, and like I said, they have access to any of these. We are more than happy to set up additional training sessions. So if you want to focus on a certain group that you have, whether that's a certain department or school, and talk about how these resources can support them, we're happy to set that up. And then if you are someone who doesn't have access to these things or doesn't have access to a certain module we talked about or looked at that you want to add to your subscription or start a new subscription, we can get you in touch with your rep, whether that's the lovely Shelby or other members of her team. We'll be able to connect you with someone that way you want to explore these more. We can also talk about some of the bundling that we talked about that we see done where people bundle different anatomy TV modules, bundle different Ditki courses, and how they use them kind of as complements to each other. We can deep dive all of that with you all. Well, that's it for me. That's about all I have. I know I'm over time. Shelby, any last, any last words? Sounds a little bit ominous, but any other things you want to add real quick?
Thanks for attending. We appreciate your participation and attendance.
Awesome. And yes, we will get the recording out to everyone. So thanks everyone who took the time to attend, and we will get this out and have a great day. Bye
Bye,
all.
everyone. Thank you.